Fear of COVID-19 has caused major disruption to healthcare. Spokesperson for the National Department of Health, Popo Maja, says a nationwide catch-up drive aimed at children under the age of 5 is set to start today, and on the 1st of November, he adds that provinces are expected to catch up on all missed immunizations by the end of March 2021. Dr. Lesley Bamford is the acting Chief Director, Child, Youth and School Health at the National Department of Health. A very good evening to you, and thank you so much for speaking to us. First, let's start with the data. What has it found with regards to immunization and just how far it fell back?
Good evening, Tsepiso, and good evening to the viewers. So there is no doubt that our immunization coverage rates, which are already less than we would like them to be, have fallen during the COVID-19 pandemic. So I think people are aware that luckily for children, they have been relatively less affected directly by COVID-19, with fewer cases, few deaths amongst children. But we are very concerned that if we don't get our immunization coverage rates back or above our pre-COVID levels, that we will start to see outbreaks of vaccine preventable diseases, particularly measles, but of course there is the risk of outbreaks of other vaccine preventable diseases.
I mean, I did mention fear as one of the driving forces, but is there any particular reason, fear of COVID-19 at hospitals, or is it just fears of interacting with other human beings during a time of high risk to contracting COVID-19?
So we don't have data, very good, a completely clear picture. We can see that our rates have dropped significantly. We know that people's lives were very disrupted during the pandemic, and in some instances there was also disruption to our health services. We're not quite sure, exactly how much each factor has contributed to the decline. Was it because our services weren't available? Was it because people have been unwilling to access services? Were the services not being provided? Did people not have transport?
Okay, so let's talk.
So we don't know if.
I want to talk about just how big the numbers are. 7 out of 8 metropolitan municipalities unable to at least vaccinate 80% of their children with primary antigens. So how are you going to correct this? We've been just playing in the background the graphics that you've given us, and you talk about 5 pillars there. So what exactly will you be doing?
So the 5 pillars are the 5 pillars of our side-by-side campaign, which is an ongoing mass communication campaign where we aim to speak to caregivers, to families, provide them with information about all the things that children need to be healthy, to be happy, and to reach their full potential. Now, under the umbrella of the side-by-side campaign, one of the pillars is protection. And immunization is one of the key ways in which we protect our children. So starting from this week, we are having an immunization and child health catch-up drive. There are 4 aims of the drive. The first is really to restore, to strengthen, to intensify our routine immunization services. We want to send a very clear message to our healthcare workers and to caregivers and members of the community that immunization services are up and running, and children need to be accessing these services. Then we need to have a particular focus on catch-up. So by catch-up, we mean making sure that children who missed doses during the pandemic or even before the pandemic do come to our health facilities and receive those immunizations. The third aim is to, in the long term, in a sustainable way, to strengthen our catch-up program. It seems that many people in South Africa believe that, for example, if a child misses their 6-month immunization and they're now 7 months, that they have missed that opportunity. Where in fact, immunizations can be caught up. There are some immunizations that have an upper age limit, but in general, all our immunizations should be given to all children under 5.
And I understand that just in terms of what children who would have missed or should be getting is deworming treatment, vitamin A supplements, information about nutrition and appropriate treatment for infections, as well as diarrhea. Would this be new entrance into the system, so to speak, or just part of the continual program?
Well, so in fact, the fourth aim of the drive is to ensure that children who miss these routine services, these are all services that are routinely provided to children in our primary healthcare facilities. But again, we know that children have missed those services. So families are often most aware of immunizations, but when children are brought for immunizations, they should also receive routine treatments like vitamin A, like deworming. Their nutrition and growth should be checked, and interventions put in place if this is not adequate or optimal. So the drive will be starting this week. In the first few months, we are focusing particularly on what we're calling our 12 priority districts. These are the districts with the highest number of or under-vaccinated children, but increasingly all the other districts will be coming on board, and so the drive will run until the end of March next year, and we hope by that stage to have all our immunization services up and running, to be reaching our immunization coverage targets, and to have made sure that children who missed doses during COVID-19 have caught up those doses and are now up to date and fully immunized.
Thank you so much for speaking to us, Dr. Lesley Bamford, who's the Acting Chief Director, Child, Youth and School Health at the National Department of Health. Make sure that you do take your children to get immunized if they haven't yet. And as you heard us say, it's not too late. Right, at 7 p.m, Ibrahim Fakir, political analyst and governance special, will be speaking on the DA's new leader and the new direction for the party, especially from a policy perspective. Do stay with us.
Did you know that as a valid TV license holder, you can now win your share of R500,000 in daily prizes? Yes, you only have to renew or pay your domestic TV license. Then dial *120 *45887# or visit tvlicgames.co.za and take a chance at our Wheel of Fortune spin and win or scratch pad. Enter to win award-winning giveaways such as airtime, shopping vouchers and household appliances. Dial *120 *45887# or visit tvlicgames.co.za to enter now. Terms and conditions apply. USSD 20 cents per 20 seconds, R1.50 per entry. T's and C's apply. TV licenses, making more content possible every day. Hashtag made possible by you.
In the trenches of business, don't lose sight of the bigger picture. At Nedbank, we'll help guide and structure innovative financing solutions to take your business growth to the next level. To guide your growth, search Nedbank Bigger Picture Business Banking.